Hi everyone, my name is Susan Davies and I welcome all of you to this webinar. It's put on by the Ohio Department of Health and it's called Return to Learn Concussion Team Model. I'm an associate professor and coordinator of the school psychology program at the University of Dayton. When I previously worked in schools, there wasn't much dialogue about concussions. Teachers often didn't know when one of their students had sustained a concussion, or if they did, they weren't sure of how to accommodate the student's symptoms. And in general, educators had very little awareness of how symptoms could affect students in school. Many students who have sustained concussions go back to school and require academic and environmental adjustments while their brain is healing. And historically, school personnel have not received much training on the effects of concussions and ways to help students transition back into the learning environment. And this is the case not only for student athletes, but for the broad student population, for students who sustain injuries in play or in car accidents, in fights, and so forth. So a big part of the mission of this project is to make sure that all students who have sustained concussions return to school safely and in a supported way. So the Ohio Department of Health undertook this initiative to ensure that all Ohio schools had access to a set of training documents and support documents to facilitate sound return to learn strategies and concussion team models that will help all educators better improve their concussion recognition and response. And this comprehensive webinar was developed for concussion team members. It's divided into 3 parts. The first part will cover information on how concussions can affect students' learning, health, and social emotional functioning. The second part gives an overview of a suggested concussion team model, and there are flexible components to this team model, so it can suit all different types of school districts, different sizes, and different regions. And a core part of the model involves a designated concussion team leader and a team of collaborators. And that includes the family, medical personnel, and core members of the school team. And then the third part of this training will cover specific strategies for return to learn. So when a student comes back to school and they are still symptomatic, these documents and strategies will give members of the concussion team tools for assessing the student's recovery and symptoms and then helping figure out what are appropriate adjustments based on symptoms the student still has. It will also cover some tools for progress monitoring so that we make sure that as the student recovers from concussion, that any adjustments and supports that have been made to the learning environment are withdrawn at an appropriate pace. Part 1 is concussion effects. So first we're going to talk a bit about what a concussion is, and it is actually a type of traumatic brain injury, which really sounds more serious than the word concussion, and so there are a lot of people who advocate for talking more about how a concussion is really a type of mild traumatic brain injury. And it's caused by a direct blow or jolt to the head, face, or neck, or by a blow to the body, like in a football game when a player is tackled and their head isn't directly hit, but that blow to the body can cause the head and brain to shift rapidly back and forth. And this shifting or shaking movement results in short-term impairment of neurological functioning. And this impairment isn't easily visible on typical hospital tests like MRIs or CAT scans. So at this point, the primary way concussions are diagnosed is by a constellation of symptoms. It's difficult to discern just how many concussions are sustained every year. There are lots of different numbers in terms of students or individuals overall who are seen in hospital facilities or ERs or their doctor's offices, but many people who have sustained concussions aren't seen by a medical practitioner. So accurate prevalence estimates are very difficult to discern, and this lack of getting medical attention is really one of the core problems that we face when dealing with concussions, because often students who have had concussions are going to be going back to school with no direction from a doctor, and then teachers are left to wonder how or should they provide accommodations for a student who is symptomatic. As I already mentioned, concussions are not visible on standard CT scans or on MRIs, and many of them go unreported. So about a third of concussions in athletes still go unreported. And as I mentioned earlier, we know that concussions are not only experienced by athletes, and that our youth population in kindergartners through high schoolers are at increased risk overall of experiencing traumatic brain injuries, including concussions, and of having prolonged recovery when compared to adults. So we typically say that a concussion is a problem of function rather than structure. So it's not a structural injury like a bruise or bleed to the brain, but it's actually changes in neurochemistry in the brain. And what's happening in the brain cells at the moment of impact is that potassium ions are flowing out of the brain cells, calcium is flowing into the brain cells, and this leads the individual to feel off and to have signs and symptoms. The brain cells aren't able to properly deliver nutrients, particularly glucose, to the brain. And all of these changes make it difficult for a person to engage in many physical or mental activities. So in the next few slides, we're going to talk a little bit about what these neurometabolic changes mean for obvious signs that other people can see, but also symptoms that the individual feels and may report to a coach or to a friend or to a medical practitioner. So here are some obvious signs that people may see in an individual who has sustained a concussion. So these are things that we want our coaches and athletic trainers and athletes and teammates to be aware of, but we also want for parents and teachers and school nurses and playground aides to know concussion signs as well. And some of these may be very transient and short term, that appear just after the concussive blow, and then some of them may be more prolonged. So the individual may appear dazed or stunned, be confused about what had happened. They may answer questions more slowly than they typically would, or repeat questions. There may be a bit of transient amnesia where the individual has difficulty recalling events immediately before or after the hit, bump, or fall. The individual may or may not lose consciousness, although the vast majority of people who sustain concussions do not lose consciousness at all. That is definitely not a defining feature of a concussion. If they do lose consciousness, it will be only briefly. If there's a more prolonged loss of consciousness, that may be indicative of a more significant or severe brain injury. The individual also may show some behavioral or personality changes. They may be grumpier than usual. They may be a little bit more kind of dazed or defiant than usual. So we want to be on the lookout for overall behavior changes, relationship changes, and at school, the student may be more forgetful of class schedule or assignments. It's also important that everyone in the community be familiar with danger signs, and if any of these are observed in someone who has sustained a blow to the head or a significant blow to the body, this student should be seen in an emergency department right away, because these signs can be indicative of a more serious brain injury like a bruising or bleed that requires immediate medical attention. So you would want to observe if the student has one pupil that is larger than the other, if they become increasingly drowsy and cannot be awakened, If they have a headache that gets rapidly worse, that can indicate swelling of the brain. If there's weakness or numbness or decreased coordination, if the student is stumbling. Repeated vomiting or nausea can be a danger sign. There may be vomiting immediately after the initial impact, and that is normal after a concussion. But if it's repeated vomiting or ongoing nausea, that is considered a danger sign. If there's slurred speech, convulsions, or seizures, if the individual has difficulty recognizing people or places, or if they become increasingly confused, restless, or agitated. Again, some agitation or being upset and restless is to be expected, but if it is increasing, that can be a danger sign. Overall, unusual behavior, and the loss of consciousness, even if it is a brief loss of consciousness, does indicate that you want to get that student to the emergency department right away. Sometimes people use the words signs and symptoms interchangeably, but they're really different things. So the signs that we talked about are things other people can observe. Symptoms are self-reported in the individual. And the CDC breaks concussion symptoms down into these four major categories. The first is cognitive symptoms. So the effects of a concussion on one's thinking. So somebody who's had a concussion may report feeling slowed down, have trouble concentrating, and have trouble remembering new information. And this difficulty with learning is such an important piece for educators to be aware of, that as the brain is going through that challenging process of healing and as their neurochemistry is trying to get back into balance, it is almost too much to ask that brain to learn all kinds of new information. The second category is physical symptoms, and one of the most common symptoms of a concussion is a headache. The individual may also have fuzzy or blurry vision. Typically, that resolves more quickly than the headache does. There may be nausea or vomiting early on. There frequently is sensitivity to noise or light. Someone who's had a concussion often feels best when they're in a quiet, dim, or dark room, especially in that first day or couple of days following the concussion. And then that can gradually change to maybe wearing sunglasses or earplugs to kind of muffle some of that intense stimuli. Physically, they may also just feel off kilter and have balance problems and overall feel exhausted, feeling tired, having little or no energy. The third category of symptoms are the emotional and mood symptoms, and these are caused both by the actual physiological changes that happen when there's been a concussion, but also after a mild traumatic brain injury. There may also be some situational variables that change that can lead to some of these emotional mood symptoms. So if you have a student athlete who was injured and then they're no longer able to play or practice, or if you have a young driver who had a car accident and sustained a concussion, that can also exacerbate their emotional and mood symptoms because maybe now they don't have their driving privileges and they're having some difficult situations with their parents. So often after a concussion, you'll see an individual who is more irritable than usual, have increased bouts of sadness, be overall more emotional, and have more nervousness and anxiety. And some of that also can tie in with the school piece, because if they're having cognitive symptoms and it's hard to learn new information, it's hard to concentrate in school, and they're feeling like school is more difficult than it used to be, and they're falling farther and farther behind on assignments, that can make that nervousness and anxiety all the more difficult. And then sleep symptoms is the first or the fourth category of the concussion symptoms, and it differs depending on the individual. They may sleep more than usual, they may sleep less than usual, or overall feel exhausted, but at the same time have trouble falling asleep. So when the brain is asked to do more than it can tolerate during the recovery process, those symptoms, such as the cognitive difficulties, emotional problems, sleep problems, physical symptoms, can flare. So students who are trying to tough it out and get back on the field or do all of their schoolwork and keep up the pace of their regular everyday life can cause their recovery to be prolonged and can cause their primary symptoms to flare. So at this point, the best treatment that is recommended is physical rest and cognitive rest. And we'll get more into some of those strategies for how students can achieve physical and cognitive rest later in the presentation, and when we're talking about the school-based concussion management team. Individuals recover from concussions at different rates. There are a lot of different variables that can affect how long the recovery process takes. And this slide shows the overall trajectory of recovery. And the blue line is for students who have had one or more previous concussions. The red line is for all athletes, and the green line is for students who have had no previous concussions. And what this shows is that overall, most individuals who have had concussions recover their symptoms in 3 to 4 weeks. Some feel no more symptoms after just a couple of days, and some continue to have persistent, severe symptoms for months. But we can expect that the majority of individuals who've had concussions will recover in 3 to 4 weeks. And during the recovery period, whether it's a few days or a few months or even longer, students should receive appropriate adjustments until those symptoms have resolved, and that's to keep their symptoms from flaring and to keep their recovery from being unnecessarily prolonged. And overall, one of the advantages of having a concussion team of educators who know about concussion and know about these strategies is they can help facilitate this balance between the need for physical and cognitive rest and keeping up with schoolwork, because keeping a student entirely out of school for an unnecessarily long period of time and just having them be in a quiet, dark bedroom also isn't good for their recovery. So later in this presentation, I'll share with you a bit more about how we can use data to evaluate symptoms and better achieve that balance to help students recover at as strong of a pace as possible. So while there's no definitive way to discern who is going to have a quick recovery and who is going to have a prolonged recovery, it can really vary tremendously from student to student. These are some known risk factors for prolonged recovery. So if you have a student who has a developmental history of learning disabilities, attention deficit hyperactivity disorder, or other developmental disorders, those are students who may be more affected by those cognitive symptoms and have trouble learning new information, concentrating, and so forth. Certainly if you have a student with a history of migraines or headaches, that can lead to prolonged difficulty with the physical symptoms, particularly of headaches. Students with a psychiatric history with anxiety and depression may have more intense and prolonged emotional symptoms. Likewise, students with a history of sleep disorders may be more affected by those sleep symptoms for a longer period of time. And then the concussion history is a very important facet that we need to consider, and this is one of the key points of having a concussion team in the school is we want to better track the history of concussions, not only in our student athletes, but in our general student population. Once a student has had a first concussion, that student may be at 3 to 6 times higher risk for sustaining another concussion. And not only that, but sometimes that subsequent concussion may occur with less force and have a longer recovery time with more intense symptoms that last for a longer period of time. So an important part of this concussion team is to have people who are well versed in tracking developmental and physical history and also keeping track of the student population's concussion history. As we've discussed, every concussion is different. Every student is different. They're going to have different clusters of symptoms. Some students may have many cognitive symptoms, but not really have difficulty with sleep. There may be some students who are very affected by physical symptoms, but not so much in the other categories. And there may be students who have significant symptoms in all 4 of the symptom categories. Likewise, their recovery rates will vary. The overall return to activity plan that is advocated in this model is to first help the student return to learn, to get them back to full academics, to full school days, full curriculum expectations. And once they are back at school and they are asymptomatic, meaning they have no symptoms, then they can go through the return to play protocol that is advocated by the athletic departments. So students should not be going back to athletic play, to practice, or to games when they still have concussion symptoms at all. And we'll talk a little bit more about that later in the presentation. But they can start doing some academics, returning to school while they have symptoms, as long as the school community understands how to provide the appropriate environmental and academic adjustments while symptoms are present.